sort of a true story. But it's a common story also. So I had a 10-year-old child with psoriasis. Psoriasis involved his face and his genital region. And for those of you who don't know what that might look like, I don't know if this projects, but I'll show. These are pictures of psoriasis in a child. You can see widespread redness and scaling all over the skin. Here's another picture. It involves, if I can get it on the screen, the nails, the hands, and just a horrific condition. So you can imagine a child with this. Kids have enough problems just growing up in a normal existence. The embarrassment. So that the child goes to school, his face is red and scaly. The child goes to the swim club, wants to change into his bathing suit, and has to hide around the corner because he has psoriasis, all the genital skin. So they finally get to me, the dermatologist. Their pediatrician has been trying to treat them with various cortisone creams. And imagine the disappointment when we find out that some of the topical medications that I want to prescribe, beyond what's already been tried that I think will be effective for this child, aren't covered by the insurance company. So for instance, sometimes we'll use something called tacrolimus ointment. Sometimes we'll use vitamin D analogs but they're not covered. Why? Because the patient hasn't gone through the arbitrary step therapy laid out by the insurance company. So this was a real instance. I saw this patient recently. His step therapy requirements required him to have failed a stronger topical cortisone cream and also a cream that contains coal tar. Now, two problems with that. So essentially the insurance company is making a decision on his medical treatment. The problem is we don't like to use strong cortisone creams on the face or genital area because they cause tremendous side effects, thinning of the skin and other rashes. The other thing, if you can picture, is imagine if we have to have this child use coal tar. That's sort of a black salve ointment to his face and genital area first before we can prescribe more effective and safe, elegant medications. How is that going to be perceived by his peers? It's going to stain his clothing, and it doesn't work as well. So basically, by the time we finally got this kid to the medications that I wanted to use first line, it was 3 visits later, and he had a more prolonged period of suffering from his skin disease.